So yeah, I mean, basically, I do it because I suffered through school really badly, and I still suffer.
I have a question.
Yeah.
So I have this student. He's dyslexic. He's been diagnosed with dyslexia, dysgraphia, and dysphasia.
Yeah.
Okay, now he's doing a lot of therapies. He has his psychologist also, and he's getting homework from school. He's getting homework from all his therapists. He's doing OT. He's young. Okay, so this guy now, this kid, he's overwhelmed, and so is his mother. And every time we mention homework or anything slightly related to homework, he throws a tantrum, and then his whole day it's going downhill.
Yep.
We cannot produce anything. He cannot produce anything. He's not working. He's frustrated.
Yep.
Now, some of the teachers last year, they said that he also has a tendency to be lazy. So if he does not have somebody sitting right next to him all the time, he will not work. So sure that he's got all these problems, and 70% of the reasons that he's not working is because of this disorder. But there's also the element of motivation, because we've got another student who's also got these problems, but everybody can see that he's genuinely trying harder. But again, he doesn't get all those therapies. Now I'm confused. So should we give him homework or should we not give him homework?
Well, the first thing I'd say is that it sounds like he's getting therapies, he's getting OT, he's getting all of this kind of thing. So what's happening, and I mean this in a gentle and a loving way, is it sounds like people are trying to change him from who he is. And that's a difficult task, and it might make him feel as though people don't value him. And it might make him feel as though people think that he shouldn't be him. And so he's starting from a base of thinking that the world hates him, basically, because that's what's happening.
This is coming from his parents. So the school did not advise all these things. And personally, I believe he shouldn't even have all of these. He's too young.
Yeah.
Just some therapy, just some intervention, and maybe we should go with his pace. And I was speaking to a few people, some educators, and I said, look, there's a different way of looking at progress also. If his results are not academically improving, that's not improvement. But if they're not falling, that's also improvement.
Yeah.
He's going to a senior grade, the results are not falling, that's also improvement. But, you can imagine that these learning disorders are still new. And parents are still having a very hard time accepting these.
Yeah.
And as soon as you tell the parent, we suspect dyslexia, we suspect dysgraphia, and he's got dysgraphia also. And I think dysphasia is the loss of speech. He's got that too. He's unable to. So it's overwhelming for the parents, and the parents, they just want the best.
That's it. And what the parents want is
the best.
They want the best from their their standard understanding of what the best is.
That he should be at par. And my idea about this is different. That we all have our own race. It's an individual path. We're not competing against each other. We're competing against ourselves.
Yeah.
But a lot of people don't agree, and the parents always do want the I don't know how else to say it.
The answers are always complex, because dyslexia affects people differently. Everybody is affected differently, as you know, and that's not only the manifestations are different. So some people have really bad phonological processing, some people have good phonological processing but bad working memory, etc., etc. But the emotional effect and the emotional impact it has on people is going to be different. Now, with this kid, it sounds like he might already be starting from the idea that people think he's broken and they're trying to change him. They're trying to change him around. The second thing that happens, of course, is that from there, it sounds like there's some oppositional behavior. So the laziness could be oppositional behavior. The flying into what might be a tantrum, we don't know, might be oppositional behavior if if he's given homework or something along those lines. So we already know that there's oppositional behavior. So, I was talking to my friends Vic Rayner and Sandra Tibbles, and they're very keen on saying that oppositional behavior is usually a message. It's a way of communicating something. So it's not that necessarily he's being naughty. So if you listen to Vic Rayner, Sandra Tibbles, they're really keen on helping people understand that the behavior and the oppositional behavior of a child is a form of communication. So it's up to us to listen to it. And this is therefore, there are two things we can do. Two really simple things we can do. There's a lot of really deep stuff that needs to be done. But the simple things are, first of all, trying to help this boy become more comfortable with the idea of homework. So he's almost certainly, if you're like, allergic to work and allergic to homework already. So it's our job not to change him, but to change our relationship with him in terms of homework. Now, one of the simple ways of doing this is there's a guy called Seligman in, I think it was 1968, or it could have been 67. Came up with the concept of learned helplessness and learned optimism. And you can turn learned helplessness into learned optimism through some fairly simple techniques and fairly simple strategies. And I'll throw you some of these strategies and techniques if you'd like. They're quite simple.
Yes. I'm not
Yeah, absolutely. And the second thing to do is, we talk about homework as though it's a monolithic thing, that everybody gets the same homework. Yeah. But actually, we might start to think about differentiating homework. So different kids who might need differentiated homework might get differentiated homework, and it might not even feel like homework to him. You might even think about asking him to choose his own homework. That's something that a lot of people don't think about. But, get someone to choose their own homework. They're engaging with something, and they don't feel that they're being forced to do something that they're not comfortable with. So the first thing to do is recognize that his oppositional behavior is a form of communication. Then we start to think, well, okay, what is it that's frightening him and making him so upset about this idea of homework? How can we smooth those waters? And then how can we provide homework for him which is appropriate to him? And it could start off by saying, what would you like to do? Or it could say, okay, so we've got a menu, if you like, of possible homeworks that you could choose from. Which do you want to try? Or there's a whole range of things we can do with homework. And you can differentiate by time, by input, by task, by all sorts of things. You could mark him on output. Not on output. You could mark him on input. That is, you can mark him on whether he's making an effort. And so differentiation is the third aspect of this. So recognize the communication, try to break down that learned helplessness and turn it into possibly learned optimism, and change the relationship with homework, and then change what homework we're actually giving. Or you could tell him, because he probably thinks that the homework is essentially he's being forced to show you that he can't do something, which will make him feel worthless. That's very likely that that's what he's going through at the moment. So if you make him understand that actually the homework isn't to do that, the homework is to help you understand how you or the teachers have failed him so that you can help him better. So that if he's struggling with something, then what can we do? We've clearly not taught you very well. So how can we teach you this better? So you could change his attitude towards what homework is.